Health Pioneers presents 23 vitamin D benefits that can save your life. If you are new to this channel, hit the subscribe button and turn on the notification bell for more interesting health topics. Vitamin D is kind of a big deal. Are you getting all the vitamin D you really need? Let the sunshine vitamin in. Vitamin D is called the sunshine vitamin because our bodies produce it in response to sunlight. Given valid concerns about skin cancer and premature aging, we tend to slather on sunscreen, which protects skin, but also limits the ability to produce vitamin D. This also limits the vitamin D benefits we absorb. Most doctors recommend spending about 15 minutes a day in the sun without sunscreen to give your body a chance to create its daily dose of vitamin D. You can also get it from milk and other types of dairy, and some breakfast cereals which are fortified with vitamin D. Healthier pregnancies for moms and babies. Expecting moms with low blood levels of vitamin D during pregnancy are at higher risk for potentially fatal high blood pressure, preeclampsia, early delivery, and low birth weight babies. And it doesn't stop there. Moms who are deficient in D are also more likely to require a C-section delivery and are at greater risk for infections. It's crucial for moms to have enough because D receptors in the uterine muscle may strengthen contractions during labor, one of many vitamin D benefits. The vitamin may also boost immunity for mom and baby. So how much vitamin D does a pregnant woman need? In one study, women who took high doses of vitamin D during pregnancy had a much lower risk of complications. Discuss with your doctor whether you could benefit from supplements. Prevent obesity. Another reason for expecting moms to get enough D. Researchers report that pregnant women who are deficient may actually program their babies to become obese as children and adults. 6-year-olds born to mothers with very low vitamin D levels during their first trimester had bigger waists than kids whose mothers had enough vitamin D. These kids also had 2% more body fat, the study showed. These increases may not seem like much in a news release. However, even a half-inch increase in waist circumference is a big deal, especially if you project this fat surplus across their lifespan. Keep your lungs strong. Kids born to moms who were deficient in vitamin D are more likely to develop asthma and other breathing disorders. A 3-step strategy to cure our most common health problem. We know that adequate levels of vitamin D help build an effective immune system and that the mother's immunity carries over to her child during pregnancy and beyond. Helps against diabetes. You're never too young to rake in the vitamin D benefits. Children who get enough vitamin D during their first year of life are less likely to develop type 1 diabetes later on. In fact, research shows that children who got 2,000 international units of D daily during their first year of life were 88% less likely to develop diabetes over the next 30 years. And there's some evidence that adequate vitamin D may also protect against type 2 diabetes, the form of the disease most closely tied to obesity. Men and women with the highest intake of calcium and vitamin D have a 33% reduced risk of developing type 2 diabetes. One possible explanation for this protection is that the beta cells in the pancreas that secrete insulin have vitamin D receptors. And getting enough of the nutrient may help these cells churn out insulin and keep blood sugar levels in check. Ward off autoimmune disease. Autoimmune diseases are on the rise, and insufficient vitamin D may be the reason. When vitamin D binds with receptors in the immune system, it helps our immune system to do its job more effectively, namely recognizing and attacking dangerous invaders, and not attacking normal, healthy tissue, which is the definition of an autoimmune problem. Build stronger bones. Vitamin D and calcium work together to build and maintain healthy bones. Vitamin D helps calcium do its job, and without it, our bones become brittle. How to eat in a world of fads and fiction. 2 common bone diseases are caused by a lack of vitamin D: rickets in children and osteomalacia in adults. Both lead to diffuse body pains, muscle weakness, and fragile bones. Prevent breast cancer. The research is fairly clear. Adequate levels of vitamin D can reduce your risk for breast cancer. Sun exposure and vitamin D status during the early adult years will reduce the risk of developing advanced breast cancer later in life. Women with a lot of sun exposure had half the risk of developing breast cancer as women with low sun exposure. Reduce your risk of other cancers. Breast cancer isn't the only cancer that vitamin D may protect us from. Research suggests that sufficient levels may reduce the risk for colorectal, breast, prostate, and pancreatic cancer, to name a few. In one study of 34,000 adults, those with high levels of vitamin D had a 20% lower chance of developing all types of cancers. Keep your heart healthy. This is a big one. There are 200 genes in the cardiovascular system regulated by vitamin D, and some studies have found hints that vitamin D can stop cholesterol from clogging arteries. Nutrient can also regulate blood pressure and improve the function of cells in the heart. New research shows that vitamin D3 can restore damage to the cardiovascular system caused by diseases such as high blood pressure and diabetes. Doctors now recognize that many patients who have a heart attack will have a deficiency of D3. According to lead study, it doesn't mean that the deficiency caused the heart attack, but it increased the risk of heart attack. Save your brain. Severe vitamin D deficiency has a big impact on cognitive function. People with extremely low blood levels of vitamin D were more than twice as likely to develop Alzheimer's disease or other types of dementia than those with normal vitamin D levels. Ward off colds and the flu. Most of us think about zinc and vitamin C when we think about staving off colds and the flu. A study of healthy adults found that those with blood levels of vitamin D were less likely to develop upper respiratory infections. And research out of Japan showed that school children who took 1,200 international units of vitamin D a day had a 42% lower risk of flu. Healthy arteries. Taking high doses of vitamin D may keep arteries more flexible, which can potentially lower risk for heart disease, heart attack, and stroke, a new study suggests. When overweight young black men and women took vitamin D supplements for 4 months, their arterial stiffness decreased. Positive human facial expressions and emotions. Boost your mood. Low levels of vitamin D are linked to shortfalls of the mood chemical serotonin. In studies of animals deficient in serotonin, we have shown that vitamin D improves serotonin levels. Many antidepressants and anti-anxiety medications target serotonin. Women with moderate to severe depression improved after they were treated for vitamin D deficiency. Detection and treatment of vitamin D deficiency in patients with depression may be an easy and cost-effective adjunct to mainstream therapies. Improve balance and avoid falls. When seniors participating in a Meals on Wheels program received vitamin D-rich meals delivered to their doors, their risk of falling dropped. The study appeared in the Journal of the American Geriatrics Society. Falls can have devastating consequences, especially for the elderly. Help prevent deaths from heart disease. A normal intake of vitamin D can slash the risk of early death among people with cardiovascular disease by 30%. We discovered that the right amount of vitamin D reduces the risk of death substantially. If you are at risk for deficiency, ask your doctor to check your vitamin D levels to see where you stand. Ease irritable bowel syndrome. Vitamin D benefits apply to irritable bowel syndrome symptoms, too. These supplements may relieve some irritable bowel syndrome symptoms such as abdominal pain, bloating, diarrhea, and constipation. These symptoms can greatly diminish a person's quality of life. It is evident from the findings that all people with irritable bowel syndrome should have their vitamin D levels tested, and a large majority of them would benefit from supplements. Help eliminate headaches. Chronic headaches are tough to treat and manage. Now, new research suggests that vitamin D deficiency may increase a person's risk. Men with the lowest blood levels of vitamin D were 2 times more likely to suffer from headaches weekly compared to men with the highest levels of D. Avoid heart failure. A heart attack can damage the heart muscle and, if the damage is severe, will increase your risk for heart failure. A study in mice suggests that regular consumption of vitamin D can reduce this risk. The results appear in the journal Heart, Lung and Circulation. The mice's hearts didn't develop the excessive scarring and thickening of heart tissue that typically follows a heart attack, the researchers report. You might be low on vitamin D and not even know it. Researchers have linked low vitamin D levels at birth with an increased risk of autism by age 3. Those newborns with the lowest vitamin D levels in the study had the highest risk of developing autism compared to newborns with higher levels of vitamin D, although the researchers stress that more studies need to be done to confirm this link. Ward off multiple sclerosis. With this autoimmune disease, the body eats away the protective coating on crucial nerves, breaking down the lines of communication between the brain and body. A study in neurology reveals that maintaining high vitamin D levels may help reduce the risk of multiple sclerosis. For every step up in blood level concentrations of vitamin D, the risk of developing MS decreased by 39%. And study participants with a vitamin D deficiency had a 43% higher chance of developing multiple sclerosis. Vitamin D may also have a beneficial effect the risk of relapses. Protect against severe asthma attacks. Vitamin D may cut your risk of potentially fatal asthma attacks in half. Popping vitamin D supplements slashed the risk of a type of severe asthma attack requiring hospitalization by 50%. What's more, vitamin D supplements also reduced asthma attacks that would require treatment by steroid pills or injections by up to 30%. Thanks for watching. Please like and share this video.